Hello, teacher. Hello, everybody. My name is DOAN. I'm planning part 5 of Doctor Nursing Management. Today, I introduce about the study scale with title Music Therapy: Positive Methods of Cancer Treatment. About abstract, we all know that music has a hard influence on people in general. It can make us smile when we're feeling stressed. It can take us out of our robot mode and connect us to our inner soul. But what about people living with cancer? Radiotherapy makes the patient to be confused and stressed, not able to control the breathing well in breast cancer using different breathing or OSMS or control the urine in the cervical cancer. And using music therapy inside radiotherapy room can help the patient to reduce confusion and stress during radiotherapy treatment. In the future, music therapy can help the cancer patient. Music therapy help relieve pain, improve quality of life, improve patients' mental health, and lead to interesting patients to do meditation to improve many psychological and spiritual problems, overcome the pain of cancer. Okay, everybody, uh, we begin to listen to music. Our songs make patient relax. With title The Flowers Grow Up on the Green Grass. The music make the people can relax. Make the patients get comfortable. The music make the people become feeling sharp, relaxed, and thinking a good kind of outline. Okay. And introduction rate of new cancer and cancer death continue to increase. Figures released by Local Project of International Agency for Research on Cancer in 2020 are estimated to have um, 19 million new cases and 9.9 million deaths. In 2020, Vietnam's ranked in this incident rate and 50 per 185 in mortality rate per uh, 100,000 people. In Vietnam, the more common cancer in men, including liver, lungs, stomach, colorectal, and prostate cancer, are the more common cancer, accounting for about 65% of all cancer. In women's common cancer include breast, lung, colorectal, stomach, and liver cancer. Common to prostate, the more common cancer are liver, lung, breast, stomach, and colorectal cancer. And cancer treatment is a combination treatment by many methods: surgery, chemotherapy, radiation therapy, palliative care, nutrition, psychology, or social. It can be said that in recent years, advanced treatment methods, techniques, and new drugs in cancer treatment have been researched and make great progress, especially in Ho Chi Minh City oncology hospitals. Radiotherapy has developed very strongly on par with developed hospitals in the area. Radiotherapy makes the patient were very confused and anxious. So we need to know what is music therapy. Music therapy is not about learning to sing or play an instrument. It's a music therapy session you might 1. Listen to music. 2. Move to music. 3. Sing. 4. Make music with simple instrument. 5. Write and discuss song lyric. 6. You guide immigrants with music. And music therapists work alongside other healthcare professionals such as doctors, nurses, speech therapy, psychologists, and psychiatrists. They may work with adults and children who have one symptom caused by physical illness or mental illness. Two, side effects from cancer and its treatment. 3. A terminal illness such as cancer. Why people with cancer use it? One of the main reason people with cancer use music therapy is because it makes them feel good. Listening to music can be calming and relaxing. Music therapy can be a safe place for people to explore fear, anxiety, anger, and the trend of emotional responses to living with cancer. Some studies show that music therapy can help children with cancer to cope by encouraging them to cooperate and communicate. Research into music therapy and cancer care. Music therapy cannot cure, treat, or prevent any type of disease, including cancer, but some research show that music therapy can help people with cancer reduce their anxiety. It may also help to improve quality of life and reduce symptoms and side effects. A current review in 2021 looked at all the studies using music therapy to help people with cancer. There were 81 trials with a total of more 5,566 people. The results suggested that music therapy may help with anxiety, depression, heart pain, and fatigue in adults with cancer. The design of many of the trials has limitation thought, so the authors suggest more research is needed. Uh, Follow the music therapy and cancer and the benefit of music therapy for the people with cancer. There has been a surprising amount of research done to examine the potential benefit of music for cancer patients. We intuitively seem to have guessed that music play a very important role. So what have we found? And psychological emotional benefit. The emotion that comes with cancer can sometimes feel like wrong quarter, right? And wrong quarter can go both ways and seemingly in just a few minutes. The music helps people deal with emotional up and down and with fear and reduce anxiety and improve mood. Several reviews of related studies to that have evaluated the effect of music on mood and anxiety in people with cancer. The, tri- the striking conclusions of these studies all show that music reduces anxiety and has a strong positive effect on the person's ability to cope with cancer and improve quality of life. Review of studies looking specifically at patients receiving palliative care confirm that benefit and further conclude that music is associated with an improvement in the overall quality of life cancer patients. And about the physical benefit, the physical benefit of music haven't been studied as much as the emotional benefits, but where we found it encouraging and affect vital signs like improvement in fratricide were observed in cancer patients participating in music therapy studies, including decreased heart rate, decreased respiratory rate, and decreased blood pressure. And integrated skill cells, several studies on healthy volunteers have shown that listening to music leads to an increase in the number and activity of natural killer cells in the body. Natural killer cells are an important part of the body immune system to aid in the elimination of cancer cells. And music therapy, an active treatment for cancer. Some cancer centers offer music therapy or have music CD you can borrow. For example, the University of Michigan Comprehensive Cancer Center, a CD that you can borrow and you can download song from this website. Check out the music collection you have in your iPod or library. YouTube quickly offer a variety of songs you can listen to. Some people are away wondering what gift to give someone with cancer but have music would be a suitable choice. And this is the story. The story the story about uh, a patient, a woman patient with cancer, uh, with the name The Magic of the Music Therapy. The true story of Dr. Phúc in Vietnam, who recalled a case of cancer where music helped to reverse the disease. It was on a day near the Lunar New Year a few years ago in Vietnam when he met a special patient. She was a doctor at a hospital. As a result, many people in the family are active in the medical profession, but they are terminally ill cancer patients. The female patient said in tears that she did not want to die at a young age. There were too many things she wanted to do for her family, her husband, and her children, and she also did not want to have anniversary right on the New Year Day. Will make reality and families close joy when stars come in the screen. They say, I only have a few days to live. She sobbed silently before the confidence of the doctor who was written by the hospital. He was very thoughtful and then recalled the unique method of treatment, which is that he or the patient beside follow the protocol. If you are a specialist, you must learn to play a musical instrument. These days, I often encourage the female patient that she try to eat one more spoon of this rice for her husband, one more spoon of this porridge for her child. Remember, drink this not for him. After a slight unexpected result, this patient did not die as quickly as the doctor treating her predicted. On the contrary, the more passionate she was studying music, the more the pain receded, and I have more than 2 years to do everything I want for my family, for my children. And problem and background. How knowledgeable are some patients about RT radiotherapy? Reading both international information about radiotherapy but must feel more or less afraid of RT. The patients will ask some questions such as, is RT painful? RT has complication or not? RT has any effect on internal organs? The article fatigue or refuses RT? Faced with the questions and situation of the patient. In addition to the doctor encouraging the patient to receive RT thoroughly treat the cancer or RT to relieve pain symptoms called by distant metastasis, spinal cord comprehension brain metastasis. Music therapy helps patients when entering the active room to reduce stress, fears, be of mind, but deter in RT technician. As for improvement initiative, about short term, number one, promoting department had to encourage staff cooperation, playing soft music in the radiation room for the patient to relax. Number two, recommend the habitual to support music picker USB console or device that can play music. Number three, training the auditive radiotherapy technician how to communicate with the patient, how them feel secure, and encourage the patient to focus on the music so they can relax and avoid moving during the radio. And number four, collect data on the patient musical references. Identify more music trends that make the patient feel relaxed in addition to soft music. Meditation music. Some patients will like symphonic music, chamber music, blah blah. And number five, pediatric patients need to prepare music specifically for the children. So that's when applying still on the RT table or using free devices such as a head or neck mask, abdominal mask, or a ballot. They will feel more comfortable when their favorite music is played in the radiation room. As a middle term, in addition to music radio, uh, in addition to music therapy to have patient reduce stress in the radiation room, it is recommended to plan to use some music for the entire radiation treatment area to help the patient feel more comfortable, to feel secure in treatment. The melody of music makes the patients while waiting also feel that the radiation treatment area is more like a health spa than a treatment area. At the same time, after the patients wake up for surgery, uh, chemotherapy for a long time also make the patients bored with the habit. The institutes making music throughout the radiation areas will make the patient more comfortable and enjoy the treatment. And number three, in addition, it's recommended that staff or the department attends more meditation classes to help alleviate symptoms of discomfort, pain, fatigue for patients. And number four, proposing capital fund to invest in music playback equipment, start training in meditation. And conclusion, the initiative to improve the quality of treatment for patients with music therapy has been successfully applied into radiotherapy machine room opportunity oncology habit. Initially make the patient feel relaxed, comfortable, confident in the quality of treatment of the medical team of department, as well as the initial survey on music therapy also has positive results. The patients were satisfied with relaxed music in the radiation room. The patient focused on listening to music and forgot about anxiety and stress. And this is the my reference. Okay, thank you. Thank you everybody to blessing. Thank you teacher.